Hi everyone, I am Dr. Sumiran Passey from AktivHealth. I am MD Sports Medicine and Rehab Specialist. Today's talk is basically to know more about Parkinson's. The purpose of keeping this talk was because we've been getting a lot of queries recently on Parkinson's and how rehab, so basically what is Parkinson's and how rehab is effective in Parkinson's, or you can say the role of physiotherapy in Parkinson's. So I have accumulated few questions which were sent to us by some patients. I'll try to answer them in a coherent manner if possible, and you guys have any queries, do so. We are anyways live right now. If you guys are logged in or seeing something, please send us any questions. If not, then drop us an email or call us anytime. We can chat about it, not a problem. So few questions. So I've tried to put all the questions in sequencing manner so that the talk become much easier, and I'll try to explain them in a very easy way. I'll be speaking mostly in English and Hindi, a combination thing, so that everyone can easily know more about it. So the first question is, what people have asked is, what exactly is Parkinson, and why what happens in Parkinson's. So Parkinson is nothing but change in dopamine levels in the brain. Basically they go low in brain, and that's why it hampers the brain activity. It is a slow progressive disorder. It can happen to anyone. It basically affects the brain as well as the neuromuscular system, which originates from there, and the movements which are being controlled by them are slightly being hampered. How it happens, we talk about it later on. I have also received some people have asked why does anyone suffer from Parkinson? Why am I suffering from Parkinson? So these are the questions what have been usually been asked. So mostly, if we go theoretically look at the research papers and people working on Parkinson since long, what we see is it's basically the genetic component which is there, which can trigger Parkinson in anyone. If a person anyways predisposed of Parkinson's because of their genetical structure, there could be any trigger factors, for example any pesticides or herbicides. These are which is commonly seen in environment. Stress level factors. There can be any trigger to the person who is predisposed for Parkinson. These are nothing but they can trigger them in anyone. It is usually seen after a certain age group, which is in the late 40s and 50s, in fact late 50s and 60s, and men are seen to suffer from Parkinson slightly more as compared to the females. I guess that answers why anyone has it. So there is no specific thing what you did wrong. It is just built in your genes, and it happens. What people have asked me is, what are the how do we see that we have Parkinson, or the signs and symptoms we medically call them? Or some people have asked, if someone has a Parkinson's, can we diagnose it earlier? Absolutely yes. So let's talk about the signs and symptoms. Parkinson is something where the signs and symptoms usually start on one side. As it progresses, it goes on equally on both the sides. There we differentiate them on early features. There are few things which starts way early as an early onset of Parkinson. That is tremors. Tremors is a most common thing. That is, for example, in a single hand, people start experiencing shaking of a hand. कि हाथ हिलने लगता है. That's the most common thing. This shaking of the hand, when it gets worse, it starts happening on both the sides. एक हाथ शुरू होता है हिलना, सेम चीज दूसरी हाथ में भी शुरू हो जाता है. जैसे जैसे बीमारी बढ़ती है, that is how this progresses. Mostly this shaking और ये जो हाथ हिलने वाली issues आता है, this is mostly at rest. अगर कोई Parkinson वाला इंसान कुछ काम कर रहा होगा तो ये tremors नहीं आएंगे. But if you're sitting at rest, ideally बैठे होते हैं, hand starts, hand goes into tremor. specifically also seen, what we usually see is pin rolling movement, what we call in theory. That is nothing but thumb or in index finger की movement होने लगती है. This is involuntary. People start doing these movements involuntarily. Your brain is not, is not registering this movement, but people start doing these movements. There is a constant tremor at rest. These are all the features of early Parkinson's. We usually see when patient starts walking, hand swinging gets reduced. जब हम normally walk करते हैं, हमारे हाथों की movement body के साथ चलती है. That is, when we move, our hand goes right, left, and alternate movements. But जैसे जैसे Parkinson बढ़ता है, ये वाली movement भी कम हो जाती है. So the swinging of arms usually reduced in these things. हमारी day-to-day activities starts slowing down. We call in medical terms we use a word bradykinesia. That is nothing but the movements become slow. When the basic movements in our daily activities start becoming slow, that is, for example, dressing up becomes slow and difficult. That is, it could be getting up from a chair is also becoming difficult. Our movement or our walk is also becoming slow. This is all a part of early Parkinson. We see a lot of patients sitting with tremors. The movements are very, very slow. The face expressions are literally gone. They just walk straight without even moving the arm. These are all signs of early Parkinson's. I'm just repeating these things because if someone is watching, कोई घर में है who has such features, we can always do an early diagnosis. So these movements are becoming slow, and जैसे जैसे ये चीज़ें होती हैं, the daily activities starts becoming difficult. When that happens, it starts taking a toll on anyone's psyche, and that's how the disease progresses, and that's how हम early diagnose कर सकते हैं any of these things. I guess I answered that one pretty good. So next question, what I have been asked is, can Parkinson get more worse exactly than what we have just discussed, and can get more worse, or is there a memory disorder also associated with Parkinson? So definitely, as I said before also, that early changes are one which starts setting up earlier in life. As we progresses, for example, from one hand, the issue started becoming on the opposite side. So that is how things start becoming complex. Dementia is since this is a disorder of neurotransmitters, especially dopamine in the brain, the functions of brain also slightly reduces. What happens is the cognitive function, the memory, our intellect, or perceiving things also starts becoming worse and worse as the disease progresses. That is nothing but one of how we classify as dementia is loss of memory. These are all the features of late Parkinson, or as the Parkinson progresses. As I said before also, when it starts hampering your daily activities, people come up with anxiety, depression, all such cognitive issues starts happening. What I didn't mention before was a lot of people even have issues in handwriting. These days we don't see much. आजकल हम ज़्यादा नहीं देखते हैं. But before, when we used to sign checks used to get rejected. Why? Because the signature doesn't match. Why that happens? Because the hand fine movements are reducing. When that reduces, that means the handwriting also is getting worse. That happens before. As it progresses, even holding a pen becomes difficult. Writing numbers also start becoming difficult. So these are the ones. In fact, Parkinson can also get more worse because it's, जैसे मैंने बोला था कि movements slow हो जाती हैं. That slowness also reduces, for example, in the facial expressions, in your swallowing. If you are trying to swallow a food, those movements also become difficult. The facial muscles start getting weaker, जिसकी वजह से drooling starts happening. You will see saliva starts coming out from one side. Why? Because the movements are becoming difficult now. This actually becomes of a great concern later on, क्योंकि अगर आप नहीं खा पाएंगे, if you're not able to eat, the nutrients are not going inside. Your diet actually changes. When that happens, it actually starts causing on a later stage associated muscle mass with such patients. जब ये muscle mass loss होगा, वॉकिंग स्लो हो जाएगी, मसल स्टार्ट्स बिकमिंग स्टिफर, जॉइंट की रेंज ऑफ मोशंस कम हो जाते हैं, हमारी बॉडी का पोस्चर भी बदलने लगता है. सो दिस इज अ वेरी इंपॉर्टेंट थिंग. यू विल सी अ लॉट ऑफ पार्किंसन पेशेंट्स ऑल्सो स्टूपिंग फॉरवर्ड. जो आगे झुकने वाला पोस्चर होता है, ये चीज़ बढ़ जाता है. क्यों? क्योंकि मसल स्टार्ट्स गेटिंग रियली स्टिफर एंड वीकर. जैसे जैसे आगे झुकते हैं, द स्टूपिंग इंक्रीजेस, the balance becomes a major issue. Anyways, geriatric population में balance is a major concern always. In Parkinson, that becomes a really major concern because nutrition is getting poor, your balance, your posture is anyways not right, your balance is becoming weak, the chances of falls are really enhanced in geriatric age group, right? So that's why early diagnosing and treating Parkinson becomes really important. I guess I answered a lot of things. Next question, what people have asked is how do we treat it? To that question, I would start with, before the treatment, it's always important to diagnose it correctly. I've really tried to simplify the signs and symptoms. जब जो early signs होते हैं, अगर किसी को वो features हैं, go meet a doctor, or if possible meet a specialist who works with Parkinson patients. They will take a detailed history, take your signs and symptoms, and based on that they may go for some testing also. They can go for MRI for the brain. There are very specific tests done to diagnose Parkinson also. If uske baad, if it's been diagnosed, then you start making changes, and then we talk about the treatment. That is, जब भी हम treatment prescribe करते हैं, usually the medications are effective, they reduce the signs and symptoms, but long term effect बहुत अच्छा नहीं होता है. A lot of patients who have less symptoms are cured to the max, but those who have actually a progressive disease, the medication can reduce things, but it ultimately progresses. The only thing in medication is it has to be really fine-tuned. But before medication, we always advise patients to do few changes. For example, lifestyle changes. For example, dietary changes. And then when these are also not effective, it's still bothering your daily activity, then we refer the patients for medication, and which has to be really fine-tuned so that things start becoming better. So this is the basic treatment what we talk about. Some people have also asked me what any tips for a lot of patients also ask, give us some tips. We don't want medication right now, what to do, what best can we do as a lifestyle change or a diet changes. So lifestyle changes में what I have advised people, और जो कि usually बोला जाता है कि जो daily दिनचर्या के काम होते हैं, और the daily activity works what we do, that has to be continued. For example, try to indulge in a normal morning walk, don't stop them, that's important. Try to do your daily chores by yourself. दिन के जितने भी काम होते हैं, नहाना धोना, you should not take any help from someone. Your basic getting up, less support, try to do things by yourself. Basic movements in kitchen, try to grasp something from a upper shelf. These are all movements what you should continue doing them. A lot of patients can, a lot of people ask them, और क्या कर सकते हैं? So basically, that is one aspect. You can even start gardening, for example, running, start a sport. जब तक active रहेंगे, it makes a lot of difference. That's very important. खाने की बात आती है, और the eating habits what people ask about is, as I've mentioned before, कि movement slow हो जाती हैं, and because of those the diet, the constipation happens, the food is not going properly, poor nutrition is the major concern. So the diet should be very specific to such things. For example, increase the fibrous diet. Omega-3 should be included. बहुत researches हुई हैं on coffee, green tea and stuff. Both have some pros and cons, but there's no harm in trying them. Some say long-term coffee can reduce Parkinson's, long-term green tea can also be effective. So whatever suits, but yes, dietary management is really important. For example, in AktivHealth, we run a dietary plan where we focus specifically on patients where the diet where the fibrous contents are more, protein are more, so that the muscle mass जो reduce होता है वो कम ना हो. Building up the muscle mass is one of the major concerns what we focus on. So probably that's more or less the tips and diet changes what is possible. One more question people have asked is, how is physiotherapy, or what role does physiotherapy plays in Parkinson? Is it actually important to do physio in Parkinson? Well, in fact, that was the reason why we have kept this small chat. I'll not go into details, but yes, on broad basis, what is happening is I've tried to mention जो features, जो signs and symptoms होते हैं, I've tried to mention there in our chat. So the physio is basically the end goal of physio is to make your daily activities normal, so that the daily routine movements and activities are not hampered, and you go back to all the activities what you were doing before. So that's the purpose of physio in Parkinson's. It cannot change the dopamine levels, or it cannot reverse the process, but if the signs and symptoms are all reduced, that's where the physiotherapy helps. How it helps, or what are the guidelines? So बहुत सारी रिसर्चेज हुई हैं जिसमें बोला गया है ऑलमोस्ट हफ्ते में 2 से 3 घंटे की अगर आप गुड डेडिकेटेड फिजियो और रिहैब और फंक्शनल ट्रेनिंग आप कर रहे हैं, that is pretty much effective, and exactly or 2-3 hours in a week is a good amount of time for a long term, so that the signs and symptoms starts reducing or you are back to your normal daily activities. What it should specifically focus on is specific muscle training, muscle strength, which is important. Specifically, whenever the muscle goes stiff, the ranges of the joints starts becoming reduced. So focusing on all the joint mobility, the ranges should be maintained. Most importantly is correcting the posture and correcting the balance or the gait training. Walking should become normal. Balance should, the balance training is something which has to be done for as long as possible. If that is maintained, half of the things are still sorted. So that functional training is really, really important. Muscle strength, maintaining a good posture, balance training, these are all important so that you are back to your daily activity life. Along with the physiotherapy, people should also start doing occupational therapy. That is very important or precise. For example, maintaining the fine movements. A lot of patients say that putting a button is very difficult. So buttoning, holding a pen and writing becomes difficult. The writing is literally you can't read them. So what we usually say is there are specific exercises for intrinsic hand muscles, the big muscles around there, so that gripping and writing becomes normal. That's one aspect. Second is what I usually tell patients is don't leave writing. Try to draw, take up a paper or something, start writing, scribble stuff, write numbers, play Sudoku, for example. More you write, more your brain is active, more the fine movements of the hand are maintained for long. So ये सारी movements करते रहनी चाहिए. That is really, really important. Because Parkinson also affects BP, constipation and stuff. That is the internal system. What we also suggest is if you can start meditation, yoga, meditation are very important. They help you to maintain or calm down the blood pressure, the gut movements, and overall breathing is not hampered. More oxygen goes in, the movements become much finer and better. That's one. So yoga, meditation, breathing exercises, and a lot of people nowadays have involved into Tai Chi also. You might have heard of it, Tai Chi. That is also an important thing. Why? Because they They are nothing but the maintaining this slow rhythmic movement. That is all about what we've been talking right now. That's how physiotherapy is really, really important in, or plays a very important role in reducing the signs and symptoms of Parkinson's. And that is what we specialize in, and that is what a lot of patients we have do, undergo treatment for Parkinson's. This was just, we've been just trying to put in slightly more insight. So if you guys, if someone is watching this live show or the recorded one, you know someone who is suffering from Parkinson or need help, do contact us. Drop us an email or call us. You'll find things on our website. We are happy to help you guys. We are also running Parkinson camp recently in next 1 or 2 days. It's a free camp, free assessment thing for those who are suffering from it. If you know someone, please contact us. We can really help getting back to normal and making a life more joyful and of better quality. I guess we'll wait for a few questions if there are, or we'll log out and we will wait for your insights then. Okay. Fine, perfect. So I guess we are done with this. And thank you, everyone.